Hello dears. Today I am here in my department, pathology department. So this is histopathology. All this time my friends were asking that you're always telling about your passion, family and all. So today I thought that I'll tell you or I'll discuss something about my professional life also with you. So I'm working in two labs. One is histopathology and one is clinical pathology. So I just want to discuss. Today I'm not going to tell in Malayalam. I am very much comfortable in Malayalam only, but I thought that so many non-Malayalis are also there, and in every video they are telling why are you always speaking in Malayalam. Either in Hindi or English you can speak, so those people also will come to understand about that thing. So since it is little professional thing, I thought that I'll speak in Hindi and English. So this is like what a pathologist do. I want to just discuss about, because all these people are pathologists. So what you people will be doing? Is it seeing slides or taking blood and all? So pathology means there are so many other subdivisions also inside that. Hematology is there. Hematology means everything related to blood. Histopathology means everything related to tissue. Tissue means all the body organs and all. And molecular pathology, genetics, and so many other advanced divisions are also there. But now I am concentrating on this clinical pathology, including hematology and histopathology. So today in this lab, I am here for histopathology. Here you can see, can you please show? So many specimens are there. So this is like, you can see big bottles and small bottles. So here all our body organs, mostly all of our body organs are there. Inside this fluid, can you see? This is called formalin. So you know, after a certain time, if our organs are keeping outside, then it will degrade and the smell and all will come. So for better preservation, we are using formalin. So many of you will be knowing, for you or for your relatives and all, the doctors will be telling we have to do biopsy. Soon after hearing that biopsy thing, all the people, majority of people will be like, oh my god, they have got cancer. It is not like that. Biopsy means we'll be taking a small particle, a small part of that thing with the help of a needle, and after that thing they'll be putting it inside this formalin, and from the hospital they'll be sending to the pathology department. If pathology department is not there, then they'll be sending to another lab, pathology lab. So for that preservation we are using that formalin. So after, when it comes here, so this, see, all these what you have seen is like processed samples. I have already grossed everything. But after 2 or 3 months, right? How many months we are preserving? Some 2-3 months we will be preserving. If further some query or something is there. So 2-3 months we will be preserving. After that we will be discarding. So this is like, today it is Dasara. So only little bit of samples are there. Otherwise so many samples will be there. So that's why today I got little time. And my friends also got time. That's why they are here to help me and to discuss. So these all are like in small containers. It is biopsy. You can see. Small tissue bits are there. So from liver or from breast, yeah. This is like some linear whitish coils. Can you see? Yeah, this is breast biopsy, I think. Kidney biopsy, liver biopsy. So if you are seeing something suspicious, the radiologist or the surgeons, if they are suspecting something, first they will be doing an assessment in radiologically, USG, sonography, otherwise CT, MRI, something they will be doing. So for further rightly understanding what is the tissue wise what it is, they'll be taking it for biopsy. If it is a small lump, like nodule or something, back or scalp or somewhere, then everything they'll be removing. So that will be little more bigger and they'll be sending it here. Now this is like liver and all full, they'll not be removing, because they want to know correctly what it is, whether it is cancerous or non-cancerous. Okay, so they'll be removing a small part of that. Core biopsy, if it is linear, then we will be calling core biopsy. If I am keeping on talking like that, it will go to, so I am just discussing the basic level only. So they will be sending it here. So what I am doing here is small biopsies directly we will be processing. Small, this kind of cassettes are there. So we will be putting it inside this nicely. There is, for everything there is certain rules to be followed. Which part the histopathologist has to see. Accordingly, that orientation and all we will be seeing and we will be keeping it. And for the processing, after that, just like that, we cannot make slides. For making slides, we have to form the blocks. So for that, it will take how many hours? These people will be more. कितना hours लेता है ये processing के लिए? अभी 24 hours.
14 to 16 hours.
14 to 16 hours, yeah. So after that thing, tissue processing is, you can stand there, right? 14 to 16 hours it will take. So whatever we are processing today, by tomorrow, different machines are there, different solutions are there. So this will be going from one solution to another solution for hours and hours. So after the end of 16 hours, it will be like a paraffin block. So after that thing, the technicians will be coming, they will be taking out the paraffin block, they will be cutting it, trimming it, and small that slides. On the slides they will be embedding. No embedding. What it is? Sections they will be embedding on the slide. And after that thing, after putting one cover slip also, it is like for years and years we can preserve that thing. And after that we will be sending it to histopathologist. Okay, so now I am not reporting this thing because I am interested in hematology, not in histopathology. I am more to clinical pathology and hematology. So here I am looking after the grossing part only. The histopathologists, who all are interested in histopathology, they are reporting, experienced people. So after that they will be seeing it through the microscope, and they will be identifying whether any cancerous thing or non-cancerous thing. In non-cancerous thing also, it is not like it is a benign. Benign means non-cancerous. In that also so many subdivisions are there. So according to that, the surgeon will be concluding whether she has to or he has to undergo a surgery, I mean for removing that thing, or as such if it is a benign thing, if it is not creating much problems for the patient, just like that we will be just letting it like that only. So that is after that, after reporting, it will be on surgeon's choice, oncosurgeon or whatever gynecologist or whichever specialty doctor has sent this. So the report will be going there and they will be deciding. Okay. So biopsy you understood, right? And after that thing, all these big specimens means after doing biopsy, if somebody comes to know that that is a proper cancer, and if it is there in our body, it is going to create so many problems. You know about metastasis and all. So the thing is that from one area to another area, that cancer will be spreading. It's not going to stay at that site only. It's going to affect the whole body. So as soon as possible, we have to remove that specimen. So cancer also, different types of cancers are there. Squamous cell carcinoma, adenocarcinoma, so many kind of cancers are there. So the metastasis also, to which all organs it is going to involve, everything varies. That and all is very vast. But if the surgeon decides that yeah, we have to remove it, so the full uterus they will be removing with ovaries, with fallopian tubes. Otherwise only the uterus according to the patient's age and all. If it is a young patient, just like that we will not be removing. Many of the ladies will be knowing about fibroids and all. That is like common nowadays. Many people will be knowing. So if it is a young person, we will be removing only fibroid. But if it is more than 60-65 years, then and if they are seeing any possibility of changing it into a carcinoma and all, full uterus they will be removing. So that is called hysterectomy. So full uterus specimen will be coming. Then if some lump is there in the breast, only lump they will be removing. But if it is a proper cancer going to affect other side also and going to get metastasized, full breast they will be, mastectomy they will be doing. Like that, kidney, liver and brain tissue, then what, lungs, all the organs, pancreas, spleen. So many organs we will be getting. From that, the thing is that biopsy is very easy. I mean, easy means to process, I am telling, not for reporting. But in all those big specimens, what the thing is that we should identify, one doctor who is grossing should identify which is the important thing. I mean, the reporting histopathologist may not see the gross specimen. So that's why the importance of grossing. We have to correctly identify where is the exact lesion. We have to 1 centimeter we have to make the slices like that bread loafing and all we have to do. And whatever pathology we feel, from that exact particular representative sections we will be taking and we will be keeping it for processing. Okay. So day by day, whenever I get time, I'll discuss something like this. Okay. And all these are the technicians here. I'll show you also. So when you are sitting outside, all are in Dasara dress. Okay. Every day these people are not coming like this. Today it is Dasara celebration here. So we thought of wearing this traditional dress. Okay. Yeah, this specimen came now. So I started cutting. Then only my friend was reminding me, yeah, you can take this also. So can you identify this specimen? Nothing like that, just one thing I just want to show you. So this is the fibroid from the uterus, multiple fibroids from a lady. So immediately after getting the specimen, we will be just, if it is a big mass, we will be just cutting it. So this is called fixation. So immediately we cannot take the sections because it will be very soft, so good slides will not be made. So first I'll be cutting it and keeping it here, and tomorrow when it becomes little firm, then only we will be taking the sections. Yeah. So this, since it is a fibroid, nothing, if some difference is there, some pathology is there, then the diagnosis also changes, but for me grossly it looks like a fibroid only. So since it is a fibroid, it is so simple, just blood loafing only. But if full uterus and other, if full specimen is coming, then we have to take different representative sections individually. Now we got one more specimen, it's a gallbladder. So for every specimen, before that we have to go through the, they'll be sending one clinical history also. So here everything is written. So first we have to read what all things, any stone is there inside or any cancer is there inside, what they are suspecting. So we will be correlating that imaging study, CT, MRI or USG, whatever they have done. So that also we will be correlating, and according to that we will be processing the sample. So every time this clinical pathological correlation is very important. So this is a gallbladder, you can show. This is like a pouch. So in normal body, I mean immediately after taking out it will be very fleshy. Now they have already sent it in the formalin, that's why it is little firm. So I have cut it open. So this is like this. In some gallbladder, so many stones will be there. Inside this thing we don't know whether they have taken out the stones to show the relatives and they have sent it, that we don't know. So accordingly different specimens. This I cannot just chop and give. So inside what it is, outside what it is. So in one single slide, that is the challenge here. I mean you can imagine this is a very small specimen, otherwise one full leg is coming and I have to fit the representative sections inside this thing. So carefully we have to examine and what all things, where all the pathology will be there. So we have to identify that thing and we have to do it. And technicians also help very much inside this thing, because when they are embedding, I mean instead of keeping it like this, if they are keeping it ulta, then nothing will be seen in the slide, and after that we cannot do anything. So like this, so many experienced technicians we have, they are doing very good job. So it's like a teamwork. Whatever we are doing is a teamwork for the excellent treatment for the patient.